Assalamualaikum and hello everyone. Welcome to another session on nutrition through life cycle, which is nutrition during lactation. Today, we will explore how the mother's body nourishes her infant through breastfeeding and also the physiology behind milk production, the nutritional composition of breast milk, and the special requirements during this stage. Let's begin with the Surah Al-Baqarah, verse 2 mentioned that mothers 233 mentioned that mothers may breastfeed their children 2 complete years for whoever wishes to complete the nursing period. Upon the father is their provision and their clothing according to what is acceptable. Even in Quran also it mentions the importance of breastfeed the baby until their children reach at 2 years old. Now let's begin with the physiology of lactation. Lactation involves a beautifully coordinated system between the hormones and the breast internal structure. The functional unit of the breast is alveolus. The alveolus is the functional unit of the breast, a small cavity lined with the secretory cells and these secretory cells its functions produce the milk. Yes, and surrounding these are the myopathial cells. These myopathial cells which contract to push milk out through duct when stimulated. Again, so the functional units of the breast is the alveolus and the small cavity lined with secretory cells. These secretory cells will produce the milk. And surrounding this, these are the myopathial cells. These myopathial cells will contract to push milk out through the ducts when stimulated. Now we look at on the process of the milk production, which is known as lactogenesis, which this lactogenesis happens in 3 stages. Stages number one, lactogenesis one that begins around the 16th week of pregnancy. It means that before you give birth, it happened already lactogenesis once, where the milk stops forming. Lactogenesis 2 it kicks in about 3 to 8 days after birth, and this is when you feel the milk comes in. Means that after you give birth 3 to 8 days, then you will feel that your breast will be full, which means that the milk is already there or milk comes in. And the third lactogenesis 3, it happens by day 9 after you give birth, where milk supply and composition stabilize. During this process, there are two important hormones that involve during lactation that you have to remember. Number one is prolactin. Prolactin is pro it means production, lactin, production of the milk. So this prolactin hormones helps to produce the milk. Number two, the second hormone is oxytocin. So this oxytocin it triggers the ejection of the milk. Okay, and this is the famous let down reflex, which it can be even triggered just hearing by the baby cry. Now we go to the second session of this topic, which is the composition of human milk. Now, let's talk about what is in human milk. Breast milk is nature's perfect food, especially tailored for human infants. It changes during the days, over the weeks, and even during a single feeding. At first, mothers produce colostrum. What is our colostrum? Colostrum is a thick yellowish fluid rich in proteins, vitamin A, sodium, and immune factors like IgA and lactoferrin. As the days progress, mature milk takes over. So these are the quick breakdown of its content of the mature milk. It contains of water, energy, lipids, proteins, and also carbohydrates. For water, this mature milk is the main component which helps to keep baby hydrated. And for energy, for mature milks, it contributes to 0.65 to 0.75 kilocal per milliliter, which is most of them consist of fat. And in the mature milk, the lipids provide 50% of the energy that contains DHA, which is good for brain development, and cholesterol for cell growth. The fourth one is the protein. The protein in breast milk or mature milk, it has lower than cow's milk but higher in whey protein like lactoferrin, which lactoferrin is very important because it can protect and also easily digestible compared to other kind of protein. And the fifth one is the carbohydrates, which the carbohydrate mostly are lactose and over 200 oligosaccharides, which is these oligosaccharides are crucial for gut health and immunity. Apart from that, vitamins minerals also contains inside the mature milk. The fat-soluble vitamins, vitamin A, D, E, K, are present, but it depends on the maternal diet, especially vitamin D and vitamin K. So the presence of these vitamins is depend on the maternal diet. The second one is the water-soluble vitamins like vitamin 12, B12, and folate that are affected by also a maternal diet intake or deficiencies. That's why the maternal diet during breastfeeding also will contribute to the presence of the vitamins and also minerals. For the minerals, calcium, iron, and zinc are more bioavailable than in cosmetics. So this shows that on how nutritious is the mature milk for the baby. Now we go to the section 3, which is benefits of breastfeeding. So why is breastfeeding so highly recommended? Okay, for mothers, it promotes uterine contraction, okay, thanks to the oxytocin. So this hormone of oxytocin, just now there are two hormones, prolactin and oxytocin. But for the oxytocin, the secretion of the oxytocin actually can helps to contract the uterine. Number two, it will delay the menstruation. And number three, it can reduce risk of some cancers and also emotional bonding and confidence. Next, the breastfeeding the benefits for infants, it offers optimal nutrition, protection from infections and chronic diseases. They have a better cognitive development and reduce risk of obesity, allergics, and even leukemia. And let's not forget, it's also cost effective and always available at the perfect temperature. Now we look at on the section 4, which is the breastfeeding practice. Now let's shift to how breastfeeding works in practice. To start, mothers must prepare the breast and position the baby properly. The baby should be facing the mother, tummy to tummy, with the nose level with nipple. How do you know the baby is ready to feed? They look for hunger cues like routine reflex, which means that the baby turns when cheek is touched to the breast, or baby turns head when cheek is touched. Okay, when you touch the cheek of the baby, and then the baby turns head towards that touch, we call as a routine reflex, sucking reflex, and oral searching and tongue thrusting. Do you know that the newborn may lose around 7% of birth weight in the first week? And this is normal. Don't worry. But if the baby lost 10%, a lactation consultation should be consulted. Now we go to section C, which is milk supply and demand. One common concern among mother, especially the first mother, can I produce enough milk? So the answer is yes. Milk production is based on demand. The more demand, the more the milk will be produced. The more often and effectively the baby nurses, the more milk is made. The size of the breast does not determine the milk supply. And to ensure to have enough milk supply, pumping 8 to 12 times per day This can help to maintain or increase the supply. Next session is the nutritional needs during lactation. Lactating mothers need more nutrients during lactation. They need additional 500 kilocalorie per day for the first 6 months. They need 90 grams per day for the first 6 months of protein and 13 additional 13 grams per day for the second month. And the sources that we always advise for the mom to take is eggs, lean milk, and legumes. For fats, focus on the unsaturated fat and also omega 3 like DHA and try to limit saturated and trans fat. And also during lactation, since many of the, what the mother eats will influence the content of the baby, the content of the milk. Therefore, the mothers should limit of alcohol intake, excessive caffeine intake, and common allergens, especially if the baby has colic. Food like onion, cabbage, and chocolate may cause infant colic in some cases. Next, last session, we go for the dental and long-term care. Breastfeed infants can still develop tooth decay, especially if they nurse frequently at night after 1 year. So, dental should start early at year 1 or 6 months after the first tooth appears. So the key summary for today's lecture, number one, for the lactation physiology, you look at on the milk production via alveoli, secretory, and myopetic cells. You have to know the functions of this. The hormones prolactin, milk production, and oxytocin that will trigger the letdown reflex. There are three stages of lactogenesis. Lactogenesis 1, 2, 3 is also very important. You have to know what is lactogenesis 1, 2, and 3. And human milk composition, you know that the mature milk have we have high in cholesterol, okay, rich in IgA, proteins, vitamin A, and the mature milk high in fat, lactose, and also at the same time it has low protein. And the content of the mature milk is a bioavailable nutrients in terms of of the minerals, and it tailored for the infant needs. And of course, it totally differs from cow's milk and infant formula. Next, also you have to know the breastfeeding benefits for both the infant, the mom, and as overall, it also can give benefits in terms of economic and also health saving. In terms of feeding readiness and techniques, you have to know the hunger cues of the baby, which is the rooting reflex, sucking reflex, and oral searching. And it also is very important for the mother have to know proper position, tummy to tummy, nose to nipple, and reflexes support the effective latching. Okay, last ending the milk supply and demand. The more you feed the baby, there will be more milk will be produced. And you have to remember that breast size do not determine the milk supply, and pumping 8 to 12 times per day will support the production of the milk. Last but not least, it's very important also the parents for the mothers to know that the nutritional needs during lactation, additionally of 500 kilogram per day and 19 kilogram per day protein per day for the first 6 months. Please focus on the omega-3 fats, limit trans fat, monitor the vitamin and mineral intake because it can influence the content of the breast milk. And last but not least, avoid alcohol, excess caffeine, colic trigger foods. To summarize, breastfeeding is not just about feeding, it's a complete biological, emotional, and nutritional knowledge package. Supporting mothers with the right knowledge and encouragement can make a lasting difference in both mother and child's health. Thank you for joining me, and may this knowledge empower you in your role as a future health professional. Wassalam, and see you in the next lesson.